in oncology recommends the use of the photobiomodulation. We have the International Society of Oral Oncology and the Multinational Association of Supportive Care in Cancer. These prestigious, well-known associations recommend the use of the photobiomodulation, and they recommend its use for the preventive methods and also for the curative methods. I will talk about this, and I will define for you the oral mucositis because it is the most frequent complication of the patients, of the cancerous patients. In fact, as I said, it's very frequent. 80% of the patients that will underwent a high-dose chemotherapy will manifest oral mucositis, and 80% of the patients that will underwent head and neck radiotherapy will manifest oral mucositis. So very frequent complication. It will interfere with the patient's quality of life. I will share with you the assessment scale to see how severe it is. The other complications beside oral mucositis are taste alteration, dysphagia, so the problem with the swallowing, the impairment of the swallowing, hyposalivation, and in some extreme cases, the xerostomia, so no saliva at all, dermatitis, the inflammation of the skin, and now the literature is very strong concerning the use of the photobiomodulation in oral mucositis, and this is why it is recommended by the ISO and the MASCC. But studies now, and I've published some case reports I will show you today, studies now are being conducted on the other complications. This is also very promising. So I've published a case report on a patient who had a breast cancer, and after her hormonal therapy, she was healed from the cancer, but she had the chronic dysphagia. And I showed in this study that the photobiomodulation was able to heal this chronic dysphagia. Another case series related to oral mucositis, dysphagia, oral dryness, taste alteration, and the sensation of the burning mouth sensation, also treated with the photobiomodulation in different patients. And the third study was a case report on a patient who underwent head and neck radiotherapy. He was healed, but he had these complications of the oral cavity that persisted: oral mucositis, dyschezia, and oral dryness. Dyschezia is the same as the taste alteration. And also, we used the photobiomodulation, and he was healed, okay? So these 3 articles are found in PubMed, and they are open access article, free of charge. You can read them, because maybe I cannot say everything in the discussion. You can read exactly the protocol, the treatment parameters, and you can apply it in your clinics, okay? So let's start by defining the oral mucositis. According to the National Cancer Institute, oral mucositis is the inflammation of the oral mucosa. This can be due to radiotherapy or chemotherapy, and the combination of both radiotherapy and head and neck chemotherapy and head and neck radiotherapy. So it's the acute inflammation of the oral mucosa. Let's check the assessment scale. As I've said, according to the National Cancer Institute, oral mucositis grade 1 can be just a moderate pain that is not interfering with the food, not interfering with the oral intake. Grade 2, a severe pain that can interfere with the oral intake, so maybe the patient must stop eat any solid food. The grade 3 is a life-threatening consequences, and an urgent intervention is indicated. And according to the National Cancer Institute, the grade 4 can be the death of the patient just due to the inflammation of the mucosa due to the oral complications, okay? So this is a very severe and something that really interferes with the quality of the patient's quality of life of the patients. And till this day, you can ask any oncologist, there is no much to do. There's no other ways. So this is why the photobiomodulation is extremely important in this topic. So the protocol that I've used in my study was to irradiate